We've been working on telehealth probably now for 2 years and developing some projects that we hope to pilot in the coming weeks across 9 practices in Tower Hamlets. And those projects involve offering patients a variety of ways into GP care using the online space and advancing technology, in part to help us cope with increasing demands for patient appointments which many practices are struggling to meet. Those channels include the ability for a patient to use their own GP practice website to access advice on their conditions so that they can be empowered to look after themselves and perhaps manage their condition themselves with the use of their local pharmacist or other resources. We are offering patients the ability to use online questionnaires for 80 minor conditions so that they can deposit their clinical information into a questionnaire and send that over to their practice, and the practice will respond to that within 1 business day, hopefully with the advice and treatment that the patient needs, and in the majority of cases avoiding the need for them to come into the GP surgery, which is clearly more convenient for the patient, and if it's clinically safer for the doctor, it improves the practice's capacity to point more activity at more needy patients. We're looking at offering patients webcam appointments with their GP, and the final offer that we're working on is to give GPs the ability to bring the expertise of specialists into the clinical consultation in the GP surgery, where they can ask a specialist from the hospital or from the community or maybe even local authority contributants questions about their patients, so that the patient then doesn't necessarily need a referral with many months of wait and anxiety and perhaps worsening of their condition during that period. So you have the relationship with one doctor, but the brains of many clinicians supporting the decision that the GP is then empowered to make on behalf of the patient. Clearly one has to be cognizant of safety concerns when one is considering moving what is considered the sort of gold standard of interaction in a face-to-face consultation to an online space. And in order to address that, one needs to be aware that you need to build in all the safeguards into that process. So we've undertaken a variety of clinical governance measures to ensure that we can identify patients whose needs are not suited to that environment, and we can red flag those patients' symptoms and escalate them, and actually all of the interactions that we're exploring retain the GP's ability to make that ultimate clinical decision so that they can bring a patient in if they have any concerns related to the information, for example in a template that's been put forward by their patient.